The US is building a facility in Kenya to keep American patients who have been exposed to Ebola in the outbreak in DRC. Americans who got sick or who were exposed to Ebola have already been prevented from returning home to the US. Instead, they were shipped to Europe. Now, anyone who is exposed in the outbreak or who develops Ebola will have to go to a quarantine and treatment facility that the US is making in Kenya right now. I asked the White House, would Americans be able to return home if they'd rather not go to Kenya? But they didn't answer my questions. This is a significant departure from what we've done in the past. Americans have often volunteered in Ebola outbreaks either to care directly for patients or to manage logistics, for instance, organizing safe burial teams, doing contact tracing, all of the really important work for stopping an outbreak. And Americans know if they get sick or if they're worried that they were in contact with a patient, they can come back home and receive some of the best medical care in the world. At least that was the case until Trump. Trump has long opposed Ebola patients coming back to the US. He said it's fine for them to go abroad and help out, but they must face the consequences. Americans have a legal right to return home, and also the US is really good at doing medical evacuations. We've done this plenty of times before with people who were exposed to Ebola or who got sick with Ebola, and no one else got sick. We also have state-of-the-art biocontainment facilities all over the country where patients like this can go to receive care safely. But without assurances that Americans would be able to return home to their friends and family or receive the medical care that would be appropriate, now experts are worried that people won't volunteer to help with this outbreak. Doctors and epidemiologists might not be able to take off work and leave their families to go to Africa for an extended period of time, not just to care for patients, but then to be contained in a quarantine or treatment facility far from home. I repeat, we have some of the best procedures for medical evacuations and receiving medical care so that no one else would get Ebola in the US. Why won't Americans be permitted to come home? Please subscribe to my channel for more updates like this.